Hey guys, it's Dr. Paul Endriss here with Dave Glazer at Blunt Force Gym here in Denver, and today we just wanted to talk to you guys a little bit about plantar fasciitis or heel pain and some things that we can be doing to try to treat those on our own. So first, plantar fasciitis is simply just my heel hurts. And a lot of times the cause of it can be overuse. Runners have this problem a lot, people who overtrain, and also because if you have a flat foot. So we're just going to go through some very simple things that we can be doing in order to treat that on our own. So here, Dave, I'm going to have you take the ball. So essentially what we want to do with the ball is just smash some of that very nasty, tight, fibrous tissue right under the heel here. And we can see Dave moving his toes around and trying to get those tendons to slide through. And like I said, a lot of the biggest problem with plantar fasciitis is that bottom structure, that bottom plantar fascia right here on the bottom of the foot will tighten up and become tight. All right, so just kind of smashing and get that, smash all that tissue there, try to move those tendons around. And what you can also do is just put your heel down on the ground and try to, and then just kind of stretch forward so you get more of the calf in there as well, and you see how that's, even gives you a bigger stretch in there. You're just trying to work those structures through the bottom of the foot. Now, part of the problem with plantar fasciitis is that the tissues on the bottom of the foot are very interconnected with the Achilles tendon and the muscles of the calf. So if you have a tight calf, it can cause issues in the bottom of the foot. And you always want to, like, if you have a problem in the heel, go up and down from the source of the problem. So we want to stretch some of the structures in the calf. So we're going to go over to the rig here. And you want to stretch the calf in 3 planes. Because when we walk, we have a very dynamic foot, and so we want to stretch the calf in 3 planes. One straight forward, you can see Dave's going straight forward towards the rig. Then we want to do one out to the right and see how that changes the stretch in the calf. And we want to do one sort of inward and see how that stretches the calf as well. Now, as we just said, plantar fasciitis is very commonly associated with an ankle motion problem. And so we want to try to increase movement in this joint. So if I'm going to have you turn around and use the band. And what you want to do is get the band right on that top crease, right on that top joint of the ankle, and try to effectively pull that top bone this direction. A lot of times this is a little bit of a unique joint because that bone actually has to slide backwards in the joint, and this is trying to help induce that motion. You should almost feel a deeper stretch almost down here in the Achilles, not like when you were stretching against the rig here, but this will actually be deeper in the joint, almost like right in here through the Achilles. And actually one more that I want you to do is, and so we're going up from the area of complaint and then down from the area. So what we want to do is we also want to stretch that big toe. And so if you can get your big toe right against the rig here, get that big toe right against the rig, and just stretch and work on motion in that big toe, you'll kind of feel that stretch along here and even maybe even back here. And try to get your knee, your toe's perfect, get your knee. And Dave's got excellent mobility here, but a lot of times people will lose mobility in that big toe, which will cause structural stress along the rest of the plantar fascia. So very simply, those are some pretty quick, dirty, easy exercises you can do to try to alleviate some plantar fascia pain or heel pain. Thanks a lot, guys.
Thank you, Paul.